Welcome back to another episode of the Wealthy Podcast. I'm your host, Shauna Nairos, and today we are talking about one of my favorite subjects ever, sleep. Can't get enough of talking about sleep these days. It is so important to our overall health. And today I've got Dr. Wayne Lai back on the podcast. He is the director of the Trank Sleep Clinic here in Kelowna. He is a neurologist here at KGH, and he is just a wealth of information on all things sleep, from sleep disorders to sleep hygiene to all of the benefits of great sleep and the challenges that we can experience to our overall health and longevity if we're not getting enough of it. You're going to want to listen up. Today's episode of the Wealthy Podcast is all about the life-changing power of a good night's sleep. We all know we need it, but how many of us truly understand what's at stake when we don't get enough of it? Sleep problems in Canada are widespread and worsening, especially among women in their 40s and 50s. Nearly 1 in 4 adults experience chronic insomnia, many turning to medications and natural aids. Meanwhile, a significant portion of adults don't get enough sleep to find it restorative. To help us understand these trends and why prioritizing sleep is critical for neurological health, immune resilience, mental well-being, and overall quality of life, I'm joined today once again by my new best friend, Dr. Wayne Lai, a neurologist and board-certified sleep medicine specialist with over 18 years of experience in both Canada and the US. Dr. Lai is the founder and medical director of Trank Sleep Care and serves as a clinical assistant professor at UBC. His practice combines cutting-edge neurological insight with the science of sleep to help patients reclaim their health. Today, we explore why sleep is not just restorative, it's protective. From its role in brain detoxification and hormonal regulation to its connection to chronic disease, mental health, menopause, and memory loss, Dr. Lai helps us understand the life-changing power of a good night's sleep. We'll bust myths about sleep aids, unpack the brain's nighttime repair system, and dive into why sleep should be considered the first pillar of healthy aging. If you've ever said, "I'm just a bad sleeper," this episode is for you because sleep isn't a luxury, it's essential. Let's get into it. Welcome, Dr. Lai. Wayne, welcome back.
Yeah, well, thank you so much for inviting me back again after last week's podcast.
Yeah, we had so much fun. It was a great podcast, and I'm happy to have you back. So I don't need to get into sort of like your story because you were able to share it with us last time, but maybe you can tell us why you're a neurologist, and there's lots of paths that you can pursue in neurology. The brain is just a fascinating organ. Why sleep?
That's a good question. So in the US, sleep is part of the neurology training. As you might know that sleep are made up of different brainwave activity that indicating different stage throughout the night. So part of the training that we need to do is to look at those brain activity, determining what stage patients are in throughout their sleep. And part of the neurology training is also looking at those brainwave activity and sort of understanding if they are normal or abnormal when it comes to diagnosing seizure disorder. So looking at brain activity is part of our training, and because sleep is part of looking at that brain activity is part of the training anyway. In the US, other specialty that also exposed or trained in sleep medicine are respirologists or pulmonologists, because a lot of the sleep disorder are regarding breathing disorder, so they are also part of that training as well. ENT, ear, nose, and throat doctor. Sometimes people have congested nose, it may have a septal deviation, they have a polyps, or they have a soft tissue called turbinate hypertrophy. They need to be removed physically. That's why they also involve as well. Family doctor and also pediatrician are sometimes involved as well. Lastly, but actually quite important, is a psychiatrist. So a lot of, and we will talk about that as well, like insomnia is a big issue, one of the most common sleep disorder. So involving psychiatrists can also deliver something called CBT for insomnia, or stand for cognitive behavioral therapy. So those are the specialties that typically involved in sleep medicines.
So, what was it about sleep medicine for you that was so compelling?
I think sleep can be quite rewarding. People would come in with complaint of horrible sleep, which obviously can lead to a detrimental effect on their social, their personal life, their work settings. Those people, when they come in seeking for help and we are able to provide treatment for them, some of those people can have a very profound, positive, dramatic outcomes. So it can be quite rewarding in that sense.
Absolutely. And I love that you've also given us an overview of all of the other specialties that are involved in sleep medicine, because it is so multifaceted. And even though, when we sleep, the body sort of stops, the brain doesn't, right? And that's really, really important. But there's all sorts of things that can affect the quality of our sleep, and we're going to get into quite a lot of them. But I tried to sort of find some recent statistics to color in the challenges that we're facing as a society around sleep. I couldn't find a super recent one in Canada. Maybe you have a more recent one than I, but from 2007 to 2015, the proportion of Canadians aged 6 to 79 experiencing frequent nighttime insomnia symptoms rose dramatically from 16.8% to 23.8%, which is a 42% jump. And given our now ubiquitous use of technology and handheld electronic devices, I would guess it's even more dramatic in the last decade. What is it about the way that we're living now that is dramatically changing our relationship with sleep?
Yeah, I think that's a very loaded and complex questions. I think it's just the overall how society are evolving into. We're just getting a lot busier now. We have a lot more things that we want to accomplish. There's a lot of information out there that we can gather at the ease of our iPad or the phone. In the past, and this is I go back to about 30, 40 years ago during my parent or my grandparents' time, their life is very simple. My grandfather is a farmer, so they will wake up when the sun comes out, they go to farm, and then they go back home when the sun goes down. And there isn't a lot of other things that can be done, but just kind of sit around and chatting, having meal. So life was much simpler back then, and now it's a lot more complicated. I do see a lot more people with sleep disorder after COVID, especially in younger populations. I think electronic devices do play parts, and there are something called iPhone syndrome, where there's other sleep disorder that are associated with excessive use of the electronic devices. And this is quite of a problematic things in younger population nowadays as well. But I shouldn't say that it's not just in younger population. I think it's in adult as well. But in adult, our brain have developed in a way, in such a stage that we can control some of our behavior. But in younger population, their brain is still developing and evolving. And it's much harder for them to in control of when they use their phone and how often they use their phone.
Mm-hmm. And I know it's it is a loaded topic. And as a parent, I know how challenging it is to create boundaries around using electronics, even for myself or my husband. But kids, it just seems that, it's become such a part of their social lives that it's really challenging. But to your point, it does dramatically impact the quality of a person's sleep experience.
Yeah, for sure. Absolutely. Yeah. There was actually a study. It was published back in 2019, I think. So it was presented at the World Congress of Sleep Medicine. So what they've done is that they took a satellite image of the entire world and look at how long do people sleep in each of the geographic area. And they also look at how developed the country is in terms of how bright the light intensity is from the street or from the satellite image. So the study shows that the brighter the environment, the less sleep that people get. So therefore, in the more developed country, people tend to sleep less compared to less developed. People tend to sleep longer.
Interesting. So even that would like translate kind of more at a micro level, like if you lived in a big city, for example, like my son lives in Toronto, more light versus say, like I have noticed maybe it's just because as I've gotten older, but where we live, it's very quiet and it's very dark. So then when I go to the city and there's like street noise and there's light coming in the window, I'm like so sensitive to it. So I think that that's also another thing that has just sort of like impacted slowly the quality of our sleep. And maybe it's more benign, we don't even really notice, but it is definitely having an adverse impact on the quality of sleep that we're able to get.
Yep.
Very interesting. So I'm going to talk a little bit more about our habits as well. I think it, again, just gives us an opportunity to talk about like why we're sort of facing this crisis of sleep. Over the last, I would say, since the Industrial Revolution, we've started to really embrace this productivity goal, right? Like work, late nights. Now we have this global economy where we're able to just keep going. It doesn't matter about time zones. We get up early, we stay up late. So like with this all in context, why is a good night's sleep not a luxury? Like, why do we need to prioritize sleep? Even though there's all sorts of wonderful things we can be doing at night when we're supposed to be sleeping, why is it so important that we prioritize our sleep?
Yeah, no, absolutely. So sleep is very important process of restorations. Without a proper sleep, our body just never had the time to reset and rest. It would be almost like running a marathon for a long period of time. At some point, you need to stop and rest and reset your body. So sleep serves a very important role in that regard. So if we don't have a good night's sleep, the multiple things can be affected, and it can be broken down to your mental health, your physical health, your cognitions, as well as your longevity. There was actually also a study looking at the longevity of how long each one of us should sleep, and actually turned out to be a bell curve, which means that people tend to live the longest if they are sleeping between 6 and 9. Anything less than 6 or anything more than 9, you tend to have a less longevity. It's not to say that if you're sleeping less than 6, you will live shorter, but it just might in the overall sense, in the population sense, 6 to 9 tend to have the longest longevity compared to people sleep less or sleep longer. That's part of it, and also there's also a lot of cardiovascular health associated with poor sleep. We'll also get into that a little bit later as well, but there's a lot of studies are now suggesting dementia, Alzheimer dementia particularly, may also associated with reduced amount of sleep or poor quality of sleep.
So totally. And I'm going to actually like just double click on that. There it is, Arden. Arden thinks it's funny when I say that. Like when so I have this watch on, and it's attached to an app on my phone, and it makes me so happy because I get to wake up in the morning and be like, have instant verification that I've had a good sleep. I've noticed, so you mentioned sleep cycle and like different brain wavelengths. And I'm actually, because you're a neurologist, I'm going to ask you about sort of the science of this. There are different phases of sleep. And if we don't sleep long enough or have that good quality of sleep, what's happening?
Yeah, so that's a good question too as well. So we do have several different stages of sleep that we go throughout the night, and it's just not one single cycle. It has multiple cycles that go through the night. So for example, when we started, we would drip into what's called a stage 1, which is transition between wakefulness and drowsiness. That's where you kind of dozing out a little bit, maybe wake up a little bit. So that transitional period is stage 1. Then slowly get into a deeper stage is called stage 2, and then you have stage 3 and 4. So in the past, we classified the non-REM into 1, 2, and 3, 4. Now it just kind of cluster together to call it stage 3 or slow wave sleep. That just means that your brain wave has a lowest frequency during that time. Once you pass the slow wave, you go into REM sleep, which stands for rapid eye movements. So that's the stage where your brain is really active. And if you look at someone who is actually in REM sleep, you can see their eye kind of bouncing back and forth under their eyelids.
So is that a really deep sleep?
That's correct. Yeah.
Okay.
So you have 1, 2, 3/4. You go into REM sleep and you cycle back to 1 and then go back to the same cycles again. So in normal 8-hour sleep, individuals should have at least about 4 to 5 different cycles. So each of the cycle lasts about 90 minutes to about 110, 120 minutes. So to get a good sleep, a good quality, you need to have a proper cycling of those sleep stages throughout the entire night. So if you to look at good sleep architecture, or what we call it, the architecture of how many time each one spend in each of the stage, if you don't have a proper amount of slow wave or the REM sleep, you just don't wake up feeling refreshed.
And what's happening? So my understanding is, again, I like to game my sleep with my app, but like it's the deep sleep state, that REM sleep, that is so vital to like the protective qualities that we're going to talk a little bit more about. What is happening in that REM state? We talked about on the last episode, the vacuum cleaner.
For sure, yeah. So some people refer to deep stage, also to 3 and 4 as well.
Yeah.
So depending on which app that you're using, deep stage can be 3, 4, also the REM sleep as well. Both stages are very important because they serve a lot of different functions, including memory consolidations, which means that anything that you learn throughout the day, if you don't spend enough time during those periods, you don't have the short-term memory transfer to an area where it becomes a long-term memory. So without that memory consolidation, you just don't retain information. Now you learn the short-term, but you don't get that transfer into the long-term memory center.
And that would also explain why there is a link to some of these neurodegenerative disorders like Alzheimer's disease and dementia, because you start to learn, or you lose that ability to, I don't know, like retrieve long-term memory.
Yeah, for sure. So during sleep, that's also when the damaged neuron or the brain cell get repaired as well. But throughout the day, we get exposed to different toxins and damage. The DNA get damaged, the neuron get damaged. It's during those times they get repaired or get replaced. There's also a concept called neuroplasticity, where the neuronal network get reset, get pruned, so to speak, and get sort of rerouted. So all those processes happen during deep stage, the 3, 4, and also REM sleep as well. So without spending enough time in those stage, you just don't have enough time for the body to do the repairing for you. Speaking of Alzheimer, there are a lot of study looking at this protein called amyloid proteins. So if someone had a good sleep, the amount of amyloid protein get excreted in the urine is more than people who don't get a good night's sleep, which means that those bad protein get retained in our body and they get tangled up with our normal brain cell, causing brain damages. So that's kind of the whole basis of why people develop Alzheimer's dementia, is you have this amyloid plaque deposit in the brains.
Like, that's enough for me. Like, I don't want plaque in my brain. okay, I'm sorry I interrupted you. Were you
No,
finished?
no worries. So no, it was that vacuum.
the
The
vacuum
concept that you
cleaner.
were referring to is that
Yes.
during our sleep, there's a lot of cleaning up, so to speak, in the brain, and if we don't allow it to be done properly, we just cannot get our toxins out of the system properly.
Mm-hmm. And the challenge is that, like, if we are sleeping in a room that's not dark enough or not cool enough, or there's noise, or we've got, oh my gosh, polyps in our whatever cavities, like my husband does, and snoring, and a person laying beside you that's rolling around, tossing and turning, you don't have the opportunity to get to that deep sleep state where those things are happening.
No, absolutely. Yeah. So I guess you're probably referring to the optimal sleep.
Yes, I am.
Yeah.
Yes, that's where I'm
yeah.
going.
So it is important to emphasize, though, it's not the duration of sleep that really matters.
Okay.
It's more the quality of the sleep.
Okay.
So analogy would be, intaking food. Like, it's not what you eat that matters. It's not how much food that you eat matters. It's what you eat and how that being absorbed matters to your body. So we really wanted to emphasize the quality of the sleep, and then duration and the timing would affect the quality to some extent. So often when patients come into the clinic, they would tell me that, "Doc, I just cannot get 10 or 11 hours of sleep." That's a bit too long to begin with, but some people are fixated and that they have to get a certain amount of sleep to get a good night's sleep, but it's actually not the duration, it is the quality.
Interesting.
And
okay.
fixated on the certain hours, we actually become counterproductive because people become anxious. They say that they have to go to bed at 11, they will have to wake up at 8 o'clock. If they're not getting that, they become really anxious and they become a trigger for insomnia.
So basically what you're saying is that the quality of your sleep matters more than the quantity of the sleep. So for example, like a 6-hour, really, let's call it a clean sleep, right?
Okay.
Where you're not disturbed, you're not getting up to go to the bathroom, like all these things is preferable to 9 or 10 hour disturbed sleep.
Absolutely. So the clean sleep, in our sense, we call it consolidated sleep.
Okay,
so if your sleep are very consolidated and they cycle through a proper sleep stages, most people wake up feeling refreshed. So that's the key outcome, is that you feel refreshed. And you have sufficient energy level throughout the day to perform the task. And obviously that sufficient energy varies from individual to individual, depending on your age and your physical fitness, things of that nature. But you need to wake up feeling refreshed.
Mm-hmm. What happens? Okay, so it wasn't on my list. I'm sorry. I'm going to throw this one at you. What happens? Sometimes like I'll sleep to like 9 hours, 10 hours or whatever. And I wake up and I feel like poop. Like, can I say that on podcast? Yeah. I just, like I feel like I slept too long. Like I went too far. Like, why do you feel like that?
Yeah. So I think some people wanted to get that duration of the sleep that they want to have, but not realizing that the last few hours of their sleep is very, very poor quality. So they wake up feeling not as good. And this happened to me too as well. Sometimes I woke up at 5 o'clock in the morning, I feel ready to go. If I had to try to go to bed and wait until 6:30, that's my normal wake up time, I actually feel a little bit less refreshed.
Like groggy.
Exactly. So sometimes I can notice that my quality in the last hour and a half is actually not good because I sort of semi-asleep during those time. So again, to emphasize that the quality of the sleep really matters, length durations. Even though we mentioned that 6 to 9 is the optimal sleep hours, there are people what we call a short sleeper.
Okay.
They only need sometimes 3-4 hours a day to get a good night's sleep. And there are long sleepers who need more than 9 hours to sleep. So it varies. So even though from a the population study perspective 6 to 9, but keep it in mind that no one is the same. Some people just need shorter and some people need a longer sleep.
Okay, so it's highly individual.
Absolutely.
Because my husband doesn't sleep a lot. I mean, he has issues, but for real though, I mean,
Yeah.
I've known him for 30 years and he seems okay.
Yeah, so some people can get by sleeping 4 hours a night, and that's how they are. They are genetically built to be able to sleep short and still get that good night's sleep.
Okay.
Yeah. So and that's important to emphasize,
It
because
is.
if you try to push that patient from 4 hours to 6 hours because thinking that 6 hours is the best, they might end up feeling not as good. And people who need 10 hours of sleep, you try to restrict their sleep to 8 or 7 or 6, they might not wake up feeling refreshed. So we do have to individualize the approach, understanding the science behind it from the population perspective, but we still need to take patient individually on each individual basis.
So when we are hearing those norms, like, you want to aim for 6 to 9 hours of sleep a night, what you're saying is, and we've had this come up in a number of our podcasts, it's based on population. So it's like an averaging
Correct.
over a large group of people.
Absolutely.
But there's a high rate of variability. So somebody that's getting 4 hours, an individual that's getting 4 hours of sleep may be getting enough sleep, and an individual that's getting 10 hours of sleep is actually needing 10 hours of sleep in order to feel refreshed and get the benefits of it.
Absolutely. Yeah. I think the analogy I normally give it to patient would be a blood pressure medication for your blood pressure. Too high of a dose will cause hypotension. It will drop your blood pressure too low to the point that you might feel dizzy. Too low of a dose might not be treating high blood pressure, so the pressure might still be high with the too low of a dose. So you wanted to achieve that balance, and that balance varies from individual to individual. For me, I might require 5 milligram of medication A to achieve that balance. For some people, maybe 2.5 milligram.
Yep. So I'm really grateful that you have said this, because I think, oddly, considering, population wise, we're not doing so good on the sleep scorecard. But there's a lot of sleep shaming as well for people that don't sleep enough. And I am so guilty of it. I'm feeling so badly right now because I do sort of really dig in when it comes to we need to get proper sleep. I've read the research, it's really, really important to overall health and longevity and all those things. But to your point, it is highly individual. So how do we know, like you say, you wake up and you feel refreshed? I think it's really worthwhile to really uncover how do we know that we're getting enough sleep? I say, oh, my poor husband, he's okay with this. He doesn't sleep a ton at night, but he gets up, goes to squash, does all the things, but then he needs a nap in the afternoon. Is he getting enough sleep? Okay, I know I have a lot of questions.
That's a good question. So let's break down a little bit here. So people who have sleep issue, we can kind of break them down into two broad category. There are asymptomatic group. People have sleep issue, but they don't have a very traditional clinical symptoms. And there's also a symptomatic group where people have symptoms, and symptoms are that they don't wake up refreshed. They wake up multiple times throughout the night. They have hard time going to sleep, or they have hard time getting up in the morning. Plus that they also have daytime symptoms, that they have low energy level. They are not able to achieve as much as they want to. Cognitive wise, they're a bit mentally foggy. So those are symptoms that we classify as a conventional symptoms. Those are the symptoms that if you have those symptoms, people would seek help, especially if that's affecting their social life and personal life, or especially if their work performance has been affected. But there are also a group of people, they are not symptomatic at all in that traditional sense, but they have other complications. they have heart attack, they have irregular heart rate called atrial fibrillation that's not able to control. They have harder to control diabetes. They have harder to control blood pressure. Those are asymptomatic group that have other cardiovascular issue that can be related to underlying sleep disorder.
Really? And so if you fix the sleep disorder, you would optimize or improve their quality of life as well.
Absolutely, yeah. So from a symptomatic patient perspective, their symptom of those non-refreshing sleep, multiple awakening, they usually get addressed by addressing the underlying sleep issue. People who are asymptomatic who have cardiovascular issue, their blood pressure may be better control. They were on 2 or 3 medication. Now they only need one to get that good control. There's the sugar, the diabetes are better control as well. People who have atrial fibrillation, if they have, let's say, for example, obstructive sleep apnea, if they have that addressed, the risk of recurrent atrial fibrillation is half of the chance.
Wow.
Meaning that if you don't get treated, you have 2 or 3 times more likely to get recurrent atrial fibrillation. There's also a risk for like stroke as well, a risk for congested heart failure. So all those are the cardiovascular risks that we know of. Not to mention, we mentioned Alzheimer. There's also a risk associated with kidney condition and also cancer as well.
Okay, so basically what you're saying is that if you're feeling like you're not getting a good night's sleep and you've just beautifully articulated a long list of symptoms that would indicate a sleep, would you call it a disorder, like a sleep disorder?
Yes. So maybe I should define symptom versus disorder.
Sure.
So symptom is what people complain of. And disorder is something that we diagnose patient with. If the
is insomnia a disorder?
So insomnia can be a symptom itself, but it's causing an impairment of some sort, and that require treatment. We classify them as disorder. I'll give you an example. When we do our sleep study, we monitor patients' leg movements. So we classify them as how restless patient is while they're sleeping. So if we see a lot of restlessness by monitoring their EMG, which is the muscle activity of the leg, we have something called periodic limb movement during sleep. So that's an observable symptom that's observable signs. So we see it. We don't classify them as a disorder unless the restlessness causing daytime symptoms, meaning that they're being disturbed throughout the night, they wake up feeling unrefreshed, then they become periodic limb movement disorder.
Interesting. Is that restless leg syndrome, or is that different?
Slightly different, but underlying pathology is similar.
Okay.
So restless leg syndrome is a clinical symptom where you have urge to move your leg before you go to sleep, impairing you falling asleep. Similar things can happen while you are sleeping, where your leg is just really restless. You're moving around quite a bit, toss and turn quite a bit. Some patients would tell me that they sleep on one side and wake up on a different side of the bed. If those signs that are being observed to associate with sleep interruptions, and that correlate with the brain activity that's been changed or affected, then they become a disorder, become an issue.
Wow. So you've mentioned that. So we've outlined sort of the symptoms. We've outlined what is indicating an issue with sleep quality and potential sleep disorder. I want to know, and you've sort of touched on this, how directly is poor sleep linked to these serious chronic conditions like heart disease, stroke, and diabetes? Like, why is it so important for us to prioritize this? Because, like, you know, as much as we say, oh, well, okay, some people only need 4 hours, many people that don't get enough sleep they know they don't get enough sleep. And the idea that I'm just a bad sleeper, even though they might say it, it's not satisfactory. And we'll get into what the opportunities are to help remedy that. But what's at risk?
Yeah, I think that's a very good point. I think a lot of people in the past thinking that sleep is not as essential as we think nowadays. If they don't get a good night's sleep, if they need to work, there's always coffee to help with waking.
Stimulant, yeah.
Exactly. And there's other things that people can do to help them to maintain their productivity. And one of the very common things also that the perceptions, understanding of sleep as well. One of the things that I heard in the clinic commonly is that I had patients get referred to me, not because the patient wants to come, but the spouse is complaining that they're snoring, right? And sometimes patients will say that it just snore. I still wake up feeling really great. Not a big deal. But snore actually is a sign of airway obstructions because we don't snore for no reasons. So there's a airway obstruction causing snoring, and therefore potentially there may be sleep interruption, intermittent dropping of the oxygen saturation level, and that can in turn causes cardiovascular complication long term. And on top of that, having a sleep issue is classified as a chronic condition. We don't have symptoms typically from high blood pressure initially. It's accumulation of the damage over years and years of hypertension or a high sugar that causing the end damage. Sleep is similar as well. So you don't get an immediate significant side effect from poor sleep, but it's accumulation of that causes more major issue in the long term. So people don't kind of realize that initially, so they kind of thinking that, okay, I don't get a good night's sleep, that's fine, I'm just gonna drink a cup of coffee and I'll get by.
And I'll catch up on the weekend.
Exactly.
Which that's not a thing, right?
Yeah. So it's a lot about education and understanding of how a chronic sleep disturbance can cause us long-term outcomes.
And those long-term outcomes are significant. So you've mentioned cardiovascular disease, heart disease, stroke, diabetes, Alzheimer's, reduced longevity, which is like a thing, you know? I mean, most of us want to live to, be able to experience our retirement fully, or, grandchildren, all of that. So we know that long-term impairment of sleep results in sort of like a shorter lifespan.
Yeah, no, absolutely. You're right that a lot of people are looking for longer longevity.
Yes.
Not only that, they're also looking to maintain the same vitality as well, right? So they wanted to live longer, but also be able to feel great and be able to participate in social events the way that they enjoyed it as long as they can.
And you have said before that sleep is kind of like the first pillar of longevity and, I guess optimizing health. Why?
Well, being a sleep physician, obviously, I have to say sleep is the most important thing. It's just like.
But I think you're right, actually.
Yeah, it's just like neurology thinking that the brain is the most important organ, and the cardiology think the heart is the most important organ. So I think as a sleep physician, I think sleep is definitely one of the most important things in life, because as mentioned, that there's so many things that happen during sleep that we are not aware of, and it's vital to maintain the intactness of our mental health, the physical health, the cognitions as well. So it is vital, and I can't stress enough that if we don't get a good night's sleep, we all know how we can suffer. Like we are not able to perform our work as much as we want to. We might be short-tempered. That's another thing, is emotional control. Like people they tend to be more short-tempered. They get angry a lot easier, and that can have a profound impact on the personal level as well as the marital level as well.
Absolutely. And you mentioned like mental health. It's sort of like this vicious cycle thing, right? Especially you mentioned anxiety. It's like you're anxious about going to sleep, and then you can't go to sleep, and then you have a bad sleep, and then you're more anxious the next day, or have feelings of depression, and then it just sort of like repeats itself over and over again.
No, for sure. I think that's one of the biggest issue that I'm starting to see right now post-COVID, especially in younger populations. We do know from the study that if people don't sleep well or they have insomnia symptoms, their risk for depression and anxiety can go up to a size 4 times of the regular populations. Even suicidal rate has increased too as well in the population of patients that don't sleep well. In younger population, we are now seeing a lot more ADHD being diagnosed in kids. I do believe, and there's some literature supporting that some of those kids are being misdiagnosed with ADHD because they don't sleep well. If you don't sleep well, you become less attentive. You become less able to concentrate at school. So they get subsequently labeled with ADHD and then get put on stimulant to treat their ADHD. So it is also important for parents to know that if your kid has ADHD, it's important to monitor their sleep to make sure that their sleep is well before it gets mislabeled with ADHD.
Mm-hmm. And it's interesting with the ADHD connection, because many of those pharmaceuticals that are prescribed to treat ADHD, and full disclosure, I have a child that has ADHD on medication, cause like they're a stimulant. So it can be difficult for kids to fall asleep at night. Like one of the side effects is wakefulness, right?
Yep.
So making sure that before we get to that place where we're considering medicine is sleep and other things, diet and the rest of it, have we looked at that?
Yep.
And can that
Absolutely.
shift have a positive impact?
Yep.
For sure. So I want to get into, the elephant in the room. Like a lot of people struggle and they go to their family doctor, or they go to their primary caregiver and say, I'm not sleeping. Like what? Like I need a sleeping pill.
Okay.
What are your thoughts on sleeping? Can I call it a sleeping pill? Is that nice to say?
For sure,
Sleep aids.
Yeah.
Like
Okay.
what are your thoughts? What happens when we take a sleeping pill, and are we going to achieve what we're looking to achieve with that?
Yeah. That's a loaded question.
I
again.
know. I'm trying to say it nicely.
No worry. Yeah. So I think definitely there's a role for pharmacological agents. It can be either non-prescribed, which is over the counter, or it can be a prescribed pharmacological agent. There's definitely a role for that in some scenario, because medication works really fast, so you can address the issue relatively fast while you are exploring other non-pharmacological agents. So there are definitely roles for that. We just have to use the medication cautiously, because somebody prescribed medication do have dependency and addictive potential.
Mm-hmm.
And I think more importantly, we also have to look into as to why people have sleep issue. That's probably more important than prescribing medications. Excuse me. One of the analogies I use is that if you have a pain somewhere, let's say you have a pinched nerve on your back, if you throw someone with a painkiller, that pain's gonna go away. But it doesn't mean that pinched nerve is going away. Right? As a matter of fact, it's still there. It's just masking the symptom. So when patients come to the clinic asking me for a sleeping pill, my response is typically that we need to find out why you're having sleep issue. Let's address that first before we prescribe you to mask your symptoms.
Mm-hmm.
Now, there are scenarios where a patient just couldn't sleep and they are to the point of breaking down or they're suicidal. I do have to use medication to intervene in the meantime and then work through what the problem may be, address that, and then slowly take them off the medications.
Mm-hmm. So the goal would be for medication to help people get to a place, like even just like a baseline, so that at least they're not so raw from lack of sleep that you can't even get to the underlying issue.
No, absolutely. So one of the most common symptoms of insomnia,
Yes.
uh,
Oh, which is
or
horrible. I've had it.
insomnia, yeah. So
Oh.
insomnia defined as difficulty initiating sleep, or difficulty maintain a sleep, or not waking up feeling refreshed, or wake up too early when you have the time to do so. So any of those symptoms are constitute insomnia. In someone who have insomnia, the best long-term treatment is non-pharmacological. It's something called cognitive behavioral therapy. So CBTI, the short version of cognitive behavioral therapy, for insomnia, it takes time and resource to be able to address that patient. So typically a CBTI runs anywhere about 4-6 weeks to even longer. So it takes time to make that changes. And in the meantime, sometimes I do prescribe medication to help with that transition in the meantime. And then once they've completed the CBTI courses or the program, when they're doing well, then we can slowly taper them up the medications. So the medication do work in that instance. I also had patients who just needed to be on medication, for long term, which is also okay as well, as long as they're being monitored and the dose and the medication that are being used cautiously.
Mm-hmm. So I want to circle back to the CBTI.
Mm-hmm.
What kinds of therapies or activities are you promoting? I know it's probably highly individual, but just overall, what are some behavioral changes that someone who might be listening to this, who's experiencing these symptoms that you've been talking about, and they know, like deep down, like that that you need to address this. What are some of the tips or the therapies that you're promoting with the CBTI?
Yeah, so CBTI is essentially addressing what we call a maladaptive behavior. I don't so psychology 101. I don't know if you ever learned something called Pavlov's dog, or there's a condition, right? So if you ring the bell and give the dog a food, after a little while, you don't need to get a food to cause salivation. It's just the bell itself cause salivation. So over our lifespan, we learn some maladaptive behavior to try to cope with our sleep issue. And that maladaptive behavior not only is not helping with the sleep, but it's perpetuating the sleep problems. So the CBTI is a program to understand the pathophysiology of sleep, so that there is a good fundamental knowledge to change your maladaptive behavior and sustain that over time. So that's what CBTI really does. If we look at the insomnia patients, there's actually been broken down to two different type of group, what we call a phenotype. There are insomnia, when you study them, they actually have good amount of sleep, but they feel that they don't. Those are definitely the maladaptive group. Where in the other group, that if you study them and they actually have shorter amount of sleep time than normal, and they actually don't feel as well, those patients require different type of approach. And there are medication that can help with this type of group of the patients. But it is the group of patients, what we used to call a misconceptions of insomnia, where people feel that they just don't sleep, but in fact, when you study them, they get good amount of sleep, and those are the patients that would benefit from a CBTI.
Oh, interesting. So you talk about maladaptive behavior. I'm gonna throw myself on the fire here. I like to enjoy an occasional glass of wine. I have learned over the years that is not a good, especially as we'll talk about menopause, but I used to think it would help me sleep. That is not a thing, right?
And that's what a lot of people do.
Yeah.
One of the behavior for insomnia over time is they start self-medicating themselves. And alcohol is a very common misused substance. Alcohol do put people to sleep. It just make you drowsy, but it causes more fragmentation of the sleep. That proper cycling of that sleep that we talk about, they have a best cycling of their sleep throughout the night, especially on the second half of their sleep. So they don't wake up as refreshed, even though they are able to fall asleep faster. So you're only addressing this sleep onset insomnia symptom, but all the other symptom of not able to maintain throughout the night, waking up non-refreshed, is actually worsened by alcohol. On top of that, alcohol is a respiratory suppressant, so it suppresses your drive to initiate breathing. So for someone who have obstructed sleep apnea, where they have obstructed airway to begin with, alcohol can actually worsen that as well.
Yeah, I've lived through that one as well.
Okay.
Not me, personally, but you know.
Yeah.
So if we're talking about cognitive behavioral therapy, would part of that protocol include sort of cutting out alcohol before bed for a certain duration? I mentioned to you before we started recording, I had great sleep last night because I've learned that if I have snackies after dinner too close to when I go to bed, I just don't have as good a sleep. So are some of those habits as well part of that cognitive behavioral therapy? Or are we talking about kind of like less superficial things?
Yeah, no, what you mentioned, those are all classified under sleep hygiene.
Oh, sleep hygiene.
Yeah,
okay.
So it would be, conducive sleep environment. A bit on the colder side. Most people like it colder to sleep.
So this is sleep hygiene.
That's correct. So as part of the CBTI, this is the sleep hygiene.
Okay.
Don't drink alcohol prior to go to bed. Not to have excessive heavy diet, meaning that high cholesterol or high sugar diet, because sugar is a fuel for energy. So if you eat too much before you go to bed, your body have to digest that somehow while you try to fall asleep, and that can impair sleep onset. You don't want it to lay in bed, try to fall asleep. So one of the things that we teach patients is not to go to bed until you feel sleepy. So that's one thing that we teach, and not to use tablet or phone or expose to any screen. Ideally, at least 2 hours prior to go to bed, but in reality, it's really hard to achieve. So we advise maybe half an hour to an hour. It's not just the tablet inhibit the release of the melatonin, which are needed to initiate sleep, but also your brain is just to engage in whatever that you're doing right now. You need time for the physiological response, as well as mental, to be able to relax, to prepare for sleep.
And it's so interesting, like as parents, when you have, Jason's got a new little baby girl, and so this is going to be his world, but I remember when my kids were little, we had like this bedtime routine, and it was super helpful because it created this kind of, like you said, like it like a Pavlov dog response, right? Where, okay, so we're going to come in from outside, we're going to take a bath, and then we're going to get our jammies on, and then we're going to tuck into bed, and then we're going to maybe read a book or, listen to some music or whatever. And there was like this whole routine around it. And like my husband and I would like actually fall asleep in the bed with the kids, right? But then somewhere along the way, we forget that, right?
Yeah, no, I think for insomnia, routine is definitely very important.
Okay.
It's prepare your body, let your body know that this is my sleep times, because to fall asleep and maintain a sleep is a very complicated process. There's a lot of neuropeptide or neurohormones that are regulating when we are awake and when we are asleep. So you do need time for body to kind of prepare for to be in that restful state, so your body can kind of fall asleep and maintaining a sleep. So for some patient, routine is very important. It just kind of condition your body that I'm going to bed at 11, and that's a couple hours prior to that, I'm going to start secreting sleeping hormone, melatonin, and reducing some of the wakefulness hormone, so that my body, when the 11 o'clock comes, I'm ready to fall asleep, and it can maintaining sleep throughout the night. If you don't have that routine, it's really hard for the body to know when to do what.
Okay. I'm getting the flags. Like, we're almost out of time. But I have some more questions and I want to get to them. Naps, yay or nay?
Yes. So it depending on what guideline you're looking at. For people who are insomniac, that they already have a hard time sleeping at night, I wouldn't recommend napping in the middle of the day because that kind of intrude your sleep consolidation at nighttime. But I understand that napping can be part of a culture, like in Asian culture, even European culture. Napping after lunch is part of what they would do, and that become their conditioned response. So if people are doing well, napping throughout the day, and they have no issues sleeping at nighttime, that's just their conditions. I wouldn't try to change that. But people have issue and they are napping throughout the day, I would advise them try not to nap and just try to consolidate their sleep at nighttime.
Okay, so again, so the napping answer, removing somebody with insomnia from the conversation, just sort of like in general population, there's like nappers and then there's like not nappers.
Correct.
And like, so my sister-in-law is like a napper and she like loves her nap.
Mm-hmm.
And she wakes up from her nap and she feels refreshed and ready to go for another 7 hours or whatever it is until bedtime.
Mm-hmm.
If I have a nap, one of two things will happen. I will have a nap and I will wake up after 20 minutes and feel like not good.
Mm-hmm.
Like,
yeah.
And like tired. Like,
yeah.
I can't pull it together.
For sure. Yeah.
That's door number one. And then the second door is like, I will have a nap and I will sleep for like an hour and a half and I just want to keep sleeping like the rest of the
So
night.
it's a cycle back to the fact that, we talk about everyone is very different.
Yeah.
We do have to individualize our treatment.
Okay.
Even though we have a guideline to follow, that no one is really the same. So one other example I can give it to you is that, we talk about not exposed to screen, not exposed to tablet. There are patients who just need to have that exposure so that they can go to sleep. That becomes their conditioned response.
Like to watch a show before
exactly.
bed. Yeah.
So if someone have to watch a show or do some reading or whatever, half an hour before they go to bed and they can fall asleep well, I don't try to change that behavior because if they are not broken, why try to fix that?
Right.
So it just keep it in mind that even though we have all this guideline, the sleep hygiene out there, it doesn't mean that every single hygiene apply to everyone equally. They are not the same.
I love that. Okay. Second burning question that I have. I am a night owl. I think that's a thing, like a real thing. I want to be one of those people like Jason who gets up at 4 a.m. and goes to the gym and like does all the things and then goes to bed at like 9. And I can't. Is that a thing, like night owls and early birds, like
yes,
hardwired?
Absolutely. So they are process.
Yes.
Yeah. So regulating sleep, there's two different processes. It's process C, which stands for circadian rhythm, which is our inner biological clock. That clock is regulated by internal hormone as well as by external stimuli. So people who are night owl, they might have what's called an advanced, delayed circadian rhythm, where their sleep onset tend to push later towards the night or early in the morning. So those people like to sleep later and wake up later, what we call the night owl. There are also early bird people who their circadian rhythm get advanced to an earlier time, so they like to sleep earlier and wake up early.
Mm-hmm.
The delay phase is typically more in adolescence, and that's a physiological changes. So when they are going through adolescent phases, their circadian rhythm or their biological clock tend to be pushed later or early in the morning. So it's not they don't want it to go to sleep sometimes. It's just that biologically they are a little bit different from their other time throughout their lifespan.
Mm-hmm.
And the advanced phase tend to be in the older population where they like to go to bed early and wake up early. So they are intrinsic or innate process that are dictating when we fall asleep and when we actually get up in the morning. Having said that, those process can be manipulated or changed by different conditions, different therapies, and also with some medications.
Okay. So we need to have you back because I want to do an episode that is like sleep through the ages, because what you've just touched on, we don't have the space to go into it today, but I feel like it's such an important area that people understand, that young people need a different amount of sleep because of what's happening in their brains and their bodies, adolescents, and that they benefit from, and like there's something in them that makes them want to sleep in, and they're not just lazy farts and like get out of bed and I jump out of bed and do this and that, so you should too kind of thing. Like that's actually working against their physiology, right?
Yeah.
And then at the same time, as we age and get into sort of those later decades, we maybe need more sleep at night, but we get up earlier is what you're saying.
Yeah,
and that's a natural transition.
No, absolutely. And I just want to also emphasize, I don't know, I think we'll run out of time.
It's okay.
But I just want to emphasize that it's important for the parent to understand
Yes.
the changes in adolescent, so they don't think that they're just being rebellious.
Or lazy.
No, exactly. So there are some natural changes that they are kind of experiencing throughout adolescent time. So understanding what's happening to their body would let us become more empathetic, in the sense that we don't kind of think that they're just rebellious or just being lazy. So it will reduce a bit of a friction between parent and the children. And the other thing that also worth mentioning, I talk about reducing the tablet time, the electronic device time prior to go to bed. I've been invited to speak about this in Summerland in the past, where there was some advocate of pushing school starting time to a later time, so that kids can get adequate sleep despite they go to bed later. One other thing that I really wanted to emphasize, though, is that as a parent, I'm guilty too as well. As a parent, I'm using phone as well up until my sleep time sometimes. So it is hard for us to convince our children that you shouldn't be using your phone, when in fact that I'm doing exactly opposite what I'm preaching you. So it is important to let the parent know that if you are letting your kids know that you shouldn't be using phone, maybe do it together and use that time as the bonding time or family time, so that the behavior can be learned at the same time, rather than preaching something that you don't actually do. Because I also kind of create a bit of a friction as well with the children.
Totally. Yeah. And I get that. Like, more is caught than taught. And it is hard as a parent, and trying to put those boundaries in place while we're on the phone. I mean, we all grew up in that generation that was like, do as I say, not as I do. But our kids have kind of figured it out, and I think we want to be better than that. So, okay, last question, and I promise you, I'm going to bring you back, and we're going to talk about that in more depth, because I do think that is a very rich topic of discussion, and a lot of people are very curious about that. Okay, but the last question, and this is also like a huge topic, so we'll just sort of skim the surface. Hormonal changes in midlife definitely, legitimately affect our sleep. Yes.
Absolutely. I think you're referring to more in postmenopausal women.
Well, like peri, I think peri, and then post for sure. But it's become sort of the topic du jour. Speaking about women's midlife changes, I think it's probably an issue for men as well, but specifically for women experiencing perimenopause, their hormonal changes will definitely impact their sleep. That's a thing.
Absolutely.
Yeah.
So estrogen and progesterone do affect sleep quality. So as women are going through perimenopausal and postmenopausal, those hormones reduce dramatically. that can affect their sleep quality. Now, on top of that, if you look at obstructive sleep apnea incidents, for example, those airway being obstructed and snoring and that type of thing, uh, prior to perimenopausal, postmenopausal, the risk of men having obstructive sleep apnea is double or maybe triple the incidence compared to women. But once women become peri or postmenopausal, the incidence is very equivalent.
Oh, wow.
Yeah.
Really?
So there is a higher risk of sleep disorder, including obstructive sleep apnea in women peri or postmenopausal. Now, in addition to that, there's also a condition, the periodic limb movement disorder, the restless leg syndrome. They are more prevalent in women, especially if they have a low ferritin level, which is iron content as well. So that's more common in female populations. Now, speaking of men, peri or postmenopausal, as we age, we tend to have more other things as well. Bit of an ache here and there, knee pain, hip pain, shoulder pain, and in men, they may have a prostate hypertrophy that kind of, so they needed to go to the bathroom more frequently at nighttime. So there's other medical factors that may also affecting our sleep as well, in addition to just the hormonal changes, but that definitely affect our sleep quality.
So you run the sleep clinic here, Trank. And so if there are folks that are listening to this episode that are just like nodding their heads going, yes, that's me. Where can they go to get help?
So we do have a clinic in town. As a specialist, I do need to have a referral coming in from GP. I'm also the medical director of the lab at Kelowna Hospital here as well. So patient who require to have an overnight study to look at different sleep disorder, including obstructive sleep apnea, we can put them through the study at the hospital. We currently also have Dr. Emlani, who is a respirologist, also working out of the hospital. And there will be a new respirologist who's specializing in neuromuscular condition coming in July as well. Actually, so he must have started early, a few days ago too as well.
Oh, wonderful.
And there's also a couple other options across town in Kelowna and West Kelowna, where there are, they call them the DME company or equipment supplying company that can do what's called a home sleep testing for simple obstructive sleep apnea. It is also knowing that those home sleep testing facility, they do sell device to patients if they needed the devices, but they do have to undergo a very rigorous accreditation process through the College of Surgeon BC as well. So they are accredited facility, and so is the facility at the hospital.
And so they can do those sleep studies.
They can do a very simple outpatient study for only obstructive sleep apnea.
Right.
The lab at the hospital is more complete and comprehensive, so I look at all different sleep disorders.
So the first stop is your primary care provider or your GP. Get the referral, come see Dr. Lai and all his friends at the sleep clinic, which is right on Pandosy. And it cannot be overstated. I think that this is a topic that impacts everybody. And as you've so eloquently laid out, our sleep needs and challenges change over time. And so we may have been a great sleeper and then all of a sudden we're not. But this is not something that we have to just live with.
No, absolutely. We shouldn't ever ignore sleep problems. Even just a day or two, or even you might think it's very mild. It does have a significant long-term consequences potentially. So if you have concern or your spouse have a concern, please do file with your doctor to make sure that proper investigation has been initiated. It may not be anything, but at least it's been investigated, and you don't have a potential long-term cardiovascular complications risk.
Well, Dr. Lai, my new best friend, this has been another amazing conversation.
Well, thank you so much for.
Is there anything else that you want to leave our listeners with before we sign off?
Maybe so our slogan for the clinic is tranquil sleep for a healthier you. So getting a good night's sleep do promote wellness, not just physically, mentally, cognitively, and also increase longevity.
Well, what better incentive is there than that? Overall health, or like what we like to say around here, wealth.
Mm-hmm.
Thank you, Dr.
Well,
Lai.
thank you
It
so
has
much.
been so great to
Yeah,
chat with you. I could
thank
keep
you.
going, but we won't for today. You are so knowledgeable and so generous with your time and sharing your expertise and your wisdom with our audience. We just thank you so much for doing what you do, and for really also, you're a neurologist, you're a very well respected neurologist, and you could stay here at the hospital and do your thing quite conveniently, but you have taken your expertise and gathered some really great clinicians to work alongside you, and taken it into community. And I think that's such an important factor for overall health and well-being in our communities right now, is to be able to have that accessibility. So thank you for doing that.
Well, thank you. I'm just glad and fortunate to be able to work here in Kelowna with a group of very good people that I'm working with. I'm really hoping that people are taking sleep more seriously, because it's not just simply getting a good night's sleep, but it does impact your overall health in general.
Absolutely. Thank you, Dr. Lai.
Okay, thank you. Thank you so much.